Okay, vaccines for people with HIV. Just as a general rule, people with HIV should receive all the regular vaccines that are recommended for the general adult population. This includes the Tdap shot and also the seasonal influenza shot, but remember, don't give the patients the live attenuated nasal formulation. You want to give them the inactivated formulation. Let's start with what I call the H vaccinations. You give the hepatitis A vaccine for patients without any documented immunity to hepatitis A. The next is the same for hepatitis B. You give the HPV vaccine for all patients ages 11 to 26. When I mentioned immunity to hepatitis, this is, for example, patients who have positive antibodies for hepatitis B surface antigen, or if they are having an active infection. All our HIV patients should get the meningococcus vaccine. These are for serogroups A, C, W, and Y, and these are for all patients. The pneumococcal conjugate vaccine is for streptococcus pneumonia. You first give the conjugate vaccine initially, and then you give the pneumococcal polysaccharide vaccine 8 weeks after that. You give it again in 5 years, and then you give it again for the patient at age 65. For the varicella zoster virus, or for the prevention of chickenpox, any patients who were born after 1979 and they have no evidence of varicella zoster virus immunity, which means that they have negative VZV antibody, which is the IgG component, you want to give them the varicella vaccine. Don't forget to also give this to children and adolescents. There is a caveat for HIV patients if they have a CD4 count under 200. If they have a CD4 count under 200, you want to make sure they do not get the live vaccine. The non-live vaccine is actually for VZV reactivation, aka shingles, and it's recommended to give at the age of 50 or above. For meningitis, the meningococcus vaccine should be given to all patients with HIV, and you give them a booster every 5 years. So let me give you a quick example. If the patient has negative hepatitis serology, give them the vaccine. If they haven't had their influenza shot, give them the vaccine. And then you see the hepatitis B panel shows positive anti-HBs. Then you don't give the hepatitis because this shows that the patient has immunity for hepatitis B. Then let's say the person's CD4 count is 250. Because it's above 200, we can also give them the varicella vaccine. If they're over 50 years old, don't forget that you can give them the non-live vaccine for shingles.